All right, this is the Proactive Podcast, Session 3. This is a podcast that breaks down the body and its biomechanics from an athlete-centered chiropractic lens. So we're getting into it today with Dr. Alex Fitchwich.
What's up, guys?
And let me
Dr. Kevin C.
He saved me on that one. All right, my name is Dr. Matthew Jurgis. And today we're talking about what we like to call the Trifecta of Care. So, Dr. Alex, what does that even mean?
So, in our clinic, we use something we call the Trifecta of Care, and it's really to make sure that your results are long-lasting, and it's more of an overall lifestyle change than anything. So, just really quickly, the three corners of the triangle, of the trifecta, are expert healthcare, which is what we do in the clinic, and aggravating factors, which are essentially everything that you do at home to mess up what we do in the clinic, and it's kind of that balance between the two. And then we add in an exercise program as well that includes stretching and other things like that. And the idea is that makes your results more robust and more long-lasting. So the idea is that the three corners of the triangle all work together to make you feel better for longer.
Yeah, and it's proven effective, almost beyond the idea is like these are really the three components of getting you better, or getting your injury better. So when someone is not getting better, you can kind of look at the three and go, which one of these are slipping? And it's one of the three, right? Nobody that's crushing everything is not getting better. I mean, in certain rare cases, but that's a whole other topic of chronic pain. So let's start with expert healthcare, which is our first starting of the three. Kevin, what is expert healthcare to you?
So expert healthcare essentially, I think, comes down to one thing is time. Like taking the time, first of all, to listen to the patient. Like, hey, what exactly is going on? Like how long has been going on for, and like what exactly are you experiencing? Subjectively, what are they feeling, right? But that's where also then we come in, after we hear them out, we go in with some really specific testings, look at the areas that we suspect may be involved and take a look at their function. From that, in combination, we develop a very specific diagnosis. And everything we do centers around having that accurate diagnosis done well. So whatever time it needs, it's worth it because every treatment that comes after that is going to be based on that diagnosis.
Mm-hmm. Yeah. And I think what we try to do to distinguish ourselves from the pack is really, we do look for a specific and objective diagnosis. And the reason is because we allow that to guide our treatment plan instead of treating everybody identically the same, which is a pretty easy habit to get into as a chiropractor, right? You adjust every patient that walks in, but what can you be doing differently that is specific to them?
Well, essentially, like, can you identify what's actually going to help the patients, or what is it that they're experiencing that needs help with? They might be saying that, oh, my neck hurts and I can't turn it. But then maybe when I go and, try to move their neck for them, it actually moves fine.
Yeah.
So, we have to bridge between what the patient is experiencing and what we objectively see in clinic and come up with a reason of why are they experiencing what they're experiencing. Mm-hmm. And that, I think, requires experts.
Right. I think the kind of mantra of this clinic is that you got to value objective over subjective.
Absolutely.
And it's the truth. I mean, you want to get the good history and you want to know it's going to be helpful, yeah. But you can't let subjective guide the treatment plan
everything,
because
like it might be like very often maybe after the first treatment the patient might feel the same and they don't feel like any progress has been made. Uh-huh. But we're working on some of the other structures that will take time before you can get subjective results.
Right. Or vice versa, where you come in, one treatment, they feel 90% better and they're ready to end treatment. And when you go in, and you feel that the tissue is still tight, the texture is still fibrotic, the joints are still jammed and locked in, and you have to tell them, I know you're feeling good, that doesn't mean you're done. And oftentimes when they don't receive that message, they'll be back in your office in a month's time with the same issue that never got treated or never got resolved, or they're going to be in someone else's office looking for the same thing.
Absolutely.
Yeah, I think that's a great way to put it, because pain very often is the last thing that shows up, and it's the first thing that goes away. And the story that we hear a lot is that patients will come in, they've been to other chiropractors, they've been to physios, they've been wherever, and they always say, yeah, it felt good for a while I was going there, but then it came back. And so our piece with the expert healthcare is, why is it there in the first place, and why is it coming back? And we see this especially with athletes a lot, is that athletes will come in, they want kind of a Band-Aid fix, they want to be able to go back and train and do their sport, but they haven't actually addressed the cause of the issue. And so, like Dr. Jer just said, they'll come back in a month and they'll have the same injury. Well, it was always the same injury. It just never got better. They never actually addressed what the source of the problem was. So even though they felt like it went away, it actually never went away.
Yeah, and that's a really good point, that pain can be the last thing that shows up and the first thing to go away, and you kind of think of it from like an iceberg model. 90% of the iceberg is under the water, and that's a hard thing to communicate, because it sounds like you're full of it when you're telling someone that you still need to come in at a lesser frequency, but we need to fix these issues that I'm feeling are still present, in order to get that long-term solution.
Right. I think something that like patients need to really understand is, just because it hurts in a certain area doesn't mean that that's where the problem lies. And sometimes it's, like for example, if I, fell on the pavement and I just, made a bruise on my knee, it's very obvious that, well, my knee is bruised. But sometimes, other times it's like my knee hurts because, I've been like running improperly, or I've been, utilizing my knee and putting too much stress through it, and that's why it hurts. And so we gotta trace it back and figure out like what other tissues might be involved, of why it's not just the area of where the pain is, but what are the other contributing tissues and areas that might be causing that issue.
Yeah, the knee's a great example, because someone can come in with knee pain, you treat their knee to the point where the knee's feeling better, but then you're like, okay, now I got to find out whether the hip or the foot is causative to this problem in the first place, which there
almost always is involved.
Always, right, some involvement.
Yeah.
But yeah, for sure.
And the knee in particular is a great example of that, because the knee is supposed to be a hinge joint. It's relatively simple. It rotates a little bit, but it mostly just bends, kind of like your elbow. Whereas your foot and your ankle are much more mobile, and your hip is much more mobile. And so it's really kind of like the knee is more of like a canary in the coal mine kind of thing. That it's like, okay, my knee is acting up. And it always seems to be that way, right? Patients always have knee problems. It's not ankle problems. It's not hip problems. That knee is the canary in the coal mine, because there's more pressure being put on those structures than it can handle. Well, why is that, right? It should be distributed through your whole leg, through your hip, through your ankle, all those kind of things. And the question is, why is all that pressure going in the knee? Because if it was the correct amount of pressure, you wouldn't be having the knee pain in the first place.
Right. So in that example, it's kind of like when we talked about like making sure we have an accurate diagnosis, are we telling the patient, oh, you came in with some knee pain, so we've diagnosed you with knee pain?
Yeah, that's a weak diagnosis.
Exactly. Or are we saying, oh, you have knee pain, actually your diagnosis is a hip dysfunction, which is like a totally, it's definitely related, great, but it is not intuitive because that's not where the pain, you feel it. But in fact, that's where the dysfunction is.
Yeah, and I find especially with knees that patients with like issues with that have seen surgeons or whatever, they're like, no, the problem with my knee is there's like gravel in there and I can feel it and I can kind of hear it. And it's like, yeah, your knee has arthritis in it or whatever, maybe meniscal derangement or tears. And that is a problem with the knee. But why is it like that? And is there more to the story than just trying to and sometimes surgery is the best option, but why is it like that in the first place?
Yeah.
And you're going to need you're going to need the treatment that addresses the joint, the muscle tissue, all that, regardless if you get surgery or not, if you want to have a long-term outcome.
And even if you do get surgery, that's the thing. It's like, okay, well, those little bone spurs, those little osteophytes didn't form overnight, right? That was a 20-year process. Okay, well, what happened every single day for 20 years? You're a construction worker, or you're a runner that doesn't run properly, or whatever it is. There's something that's putting that pressure on that knee.
Yeah.
So so that all plays into the picture of like, okay, what is this accurate diagnosis? It's not as simple as like, oh, you hurt here, oh, perfect, we'll just, rub it there a little bit to make you feel better. It's more about tracing it back and trying to find the cause of that pain.
Yeah, which is a very challenging task, and sometimes it takes a little bit of trial and error, and sometimes
Absolutely.
you get it right. But that's a hard thing. It's a hard message to send to a patient, where it's like, yeah, I get it. Like, it might not make immediate sense that I feel like the issue, I need you to get hip exercises going on, or I need you to do this and that, and maybe you're not in pain at the moment, but to fix yourself from further breakdown going on in life, we need to address this in this way.
And a lot of patients kind of know that intuitively, but it takes like a little while to point it out or to show them. Like, a perfect example is if you're working on somebody's upper back, it will be sore. You'll find trigger points. There will be tight muscles, guaranteed. Does that person even know that? Probably not, but a lot of times people will tell you, oh, I know I have to work on my posture, or I know that I sleep weird, or I know that I spend too much time at my desk or on my computer. Like, they know all of those things, and those are what's causing the issue ultimately, but it's not causing pain. It's not necessarily causing any other issues, right? And so sometimes it's really more about just illustrating to the patient, and sometimes it's checking their good side against their bad side, and it's like, you should be able to do this, but you can't, kind of thing.
And that's why it's so important to have objective findings. You attest and say, hey, you're lacking in flex. Your hip should be able to bend to this range, and you have half of that amount. So it's just as important to us as it is to them to portray the issue.
And it just makes it more precise too. Like, it's super easy for us to say like, okay, your hip rotation is supposed to be this far. It's only half. It's super easy for us to measure that even. Whereas sometimes it's like, okay, well, is my pain at like a 5 or is it a 6? Like, I don't really know. And, other things were going on and I was sore from the gym. So there's all these confounding factors. But when we get you on the table and we move your hip, we can tell exactly how much it's moving. And we can see exactly how much is improved, exactly, and you can compare it from treatment to treatment.
Yeah, I was gonna say like measuring those things as a way of demarcating of whether we're actually making progress is so much more helpful than just relying on the patient to be like, hey, how are you feeling today?
Right. And the thing about asking a patient where their pain level is or whatnot, it's really just to know, are they feeling change? Yeah, it's information to take in, but
it's a ballpark.
People need to understand that someone's 9 out of 10 pain is another person's 1 out of 10 pain, and your pain on a rainy day might be a 6, but if it's sunny out and you just had fun, it's a 4 or a 3.
100%.
Actually, like in so many patients, what I find actually where I find the gauge of whether your pain is a 1 or a 10 is actually where it's most useful is actually gauging the patient's mental state and how good or how well are they at coping with their pain. Are they in such severity of pain that we'll have to take the progress really, really slow, or they can comprehend okay what they're experiencing is manageable. It's painful, but there's a lot of painful things in life that also trumps what they're experiencing, and so they have a lot more what we call like grit, and they can they're easier to motivate them to overcome what they're experiencing to get better. Right,
because the perception of pain, I'm almost going on a limb here to say that's the quattro of the trifecta. If that's the hidden gem that maybe isn't portrayed enough, if there ever was one, because that is really the last component. Like your perception of pain, because you can have pain and that doesn't mean that anything's tearing, that doesn't mean that something's damaged, that doesn't mean that you're harming your body. You can just have pain because your body is sensitized or used to pain.
Or just having a good understanding, like what is good pain and what is bad pain. And
that's a big one too.
A lot of people don't understand that.
Yeah.
Yeah, that's a huge one. Like if they have an injury or if they have chronic pain and they're going to the gym, they need to realize that exercise pain is good and it's different than the pain of getting injured. And exactly as Dr. Drew just says, just because you have pain doesn't mean anything's getting any worse. You're not re-injuring yourself. You're not making it worse. Sometimes those tissues are just annoyed. And a lot of times what the brain will do is it will inhibit those tissues because it thinks another injury is coming, right? You roll your ankle and it's like, oh man, I really got to protect this thing. I cannot roll my ankle again. Mm-hmm. But the actual damage has been done. You already rolled your ankle. It's already done. Clean up all the swelling in there. And the ankle more or less is fine. Just do a little bit of rehab, a little bit of strengthening.
Yeah.
But the brain doesn't understand that. It's like, oh man, we're going to break our leg.
Right. It's part of our treatment is just showing the body that it's okay and that it's clear to move again and to move naturally and freely. Because it does get caught in like a pain spasm cycle.
Right. So essentially to circle back, like expert healthcare essentially I think centers around just really having an accurate diagnosis, not just saying like, oh, that's where your pain is, that's what your diagnosis is, but actually, seeing, what the whole breadth of like what are all the tissues that are involved and how should we address them, be it with ART, which is like active release therapy. Should we use other like soft tissue techniques like trigger point release? Yeah. Should we use like joint play things like such as mobilizations or manipulation, or using kind of other modalities like Graston? All those things are part of the expert healthcare piece. But once we get some progress in terms of the pain is decreasing, but also that we're seeing some objective improvements. This is where the other pieces of the trifecta come into play really importantly. And so, Dr. Alex, do you want to talk a little bit about, what are the aggravating factors? Like, what is that piece of the trifecta mean?
Yeah, that's a great point. So the aggravating factors are all the things that you do during your day that either have caused the problem or currently are making the problem feel worse. So a lot of what we talk about is posture and how you do your activities of daily living. So I tell patients this, when you come see us, you see us for 20 minutes at a time, you go home and you work for 8 hours and then you sleep for 8 hours. Okay, well that's 16 hours worth of damage that you're potentially doing to your body with poor work position, poor sleep position. That's going to completely undo what it is that I've done. And on top of that, that actually might be what was causing your problem in the first place. So we really go and look in depth with different things that you do during your day. And it depends on what your job is. For some people that work at a desk, they're going to have a certain range of issues. Another common one is like construction workers. They're going to have their own set of issues. And it really, even chiropractors ourselves, we're going to have our own set of issues from treating patients, So it really depends on what you're doing outside of the clinic as well as what we're doing inside the clinic.
Right.
Yeah. And when I came out of school, teachers and professionals talked about aggravating factors, but it just doesn't seem like the sexiest part of a treatment plan, right? It's not the most appealing. A lot of chiropractors, do you really want to sit down and kind of discuss and have a conversation about how a person should sleep, and there's a good chance that they're not going to listen, but it's such a huge part of it, and it's so big, and it can be the biggest change or biggest component of the trifecta to drive resolution and care. So it really is worth emphasizing and drilling and looking into.
I definitely agree. Like that's kind of the lifestyle piece. And we know that having a healthy lifestyle is really what's sustainable. Like that's the fountain of youth. So a lot of what we're doing is just showing our patients how to get there. And I mean, it's even bigger than that. Like it also plays into other practitioners we have at the clinic. Like a lot of it is diet. A lot of it is, potentially food insensitivities. A lot of it is, reactions to different things like nutrition, supplements, all those kind of things. What we're trying to do is get your body to be like a healthy garden so that you can grow and thrive and all those kind of things, right? We're giving you the tools to make yourself better.
Mm-hmm. Right. So like, I mean, and I kind of emphasize this stuff. Essentially, it takes time. Like it's usually it's not so easy. Like it would be awesome if patients just came in and I didn't really have to chat with them, and, just give them a quick pop and then they go. Like that makes my job super easy. Whereas difficult is sitting down with a patient, asking them the questions, going through little details of their day, like what is it that you do for a job?
Yeah.
Oh, I sit at a desk. Okay, like how many monitors do you have? How high is your chair? Do you ever get up from your desk? Like how's your vision? When's the last time you filled your vision prescription? What's the lighting like in your room? All those things play into factors, right? It'd be just easy. Oh, I have a desk job. Oh, simple. No, you gotta go into like the little details of each little thing. Not just for their work, but then you sleep. It's like, oh, sleep. What kind of positions do you go in? It's like, oh, I sleep on my side. It's like, okay, but where are your legs? Where are your hands? Mm-hmm. When you're sleeping on your side, how high is your pillow? Do you flip and stuff, or elements like that. And then we go into like hobbies, activities, sports. Like what kind of things do you do? Are you right-handed dominant, left-handed dominant? Do you play a hand-dominant sport regularly? All those things need to be taken into account to figure out like, are there things that you're doing on a day-to-day that's going to make what you're experiencing worse, or revert what we've been doing in clinic?
Yeah, and it sounds like a lot. It does sound like a lot, and it can be a lot. But you can also distill it to, what are you doing for most of your day? Are you sleeping? So 24 hours in a day, are you sleeping for 8 of them? Are you sitting on a computer for 6 to 8 of them? Mm-hmm. Are you walking for 2? Okay, there right there is, 18 hours of your day, right? So if we could tackle those 3, then we were already 80% there.
And it does sound like a lot. Like you're 100% right. Kevin's listing off all these questions that we ask people, but I actually look at that as a good thing because patients think that something's wrong with them or they have a big issue or anything like that. And a lot of times it's just all these tiny, tiny little things, little tweaks, like get a new pillow, rotate your mattress, take a 10-minute break every hour or 2 when you're working. Like it's literally all these little things that add up over time to sometimes cause those issues in the first place, but also fix those issues. Like if I have at the end of a first new patient exam, if I have a long list of things that I can check with them, that's actually great because there is a lot of progress that can be made with relatively simple things, right?
Yeah, and I actually want to tell a quick story because when you do miss, it became apparent to me how important it is once I missed one of those modifying factors. So I was treating my dad for back pain for a while, and he has disc pain, and it's been an ongoing issue. And I got improvement, but didn't really stick. We never got to that full resolution, and he was kind of inconsistent with care. But I moved, and he gave me his couch. And I got the couch set up, blah, blah, blah. And then I was sitting in it for a while. And I personally noticed, like, oh, this is not the best couch for your back. And then I talked to him, and he's like, yeah, I don't have any low back pain anymore. It's gone. And I'm like, oh, okay.
Yeah.
And then we both kind of looked at each other, and it was like,
it was the couch.
That couch.
It's that couch.
That couch is
that's
awful,
where it is.
right? And it's like,
what a
how many
minute detail,
months or years
seriously
of back pain could have been negated from just getting a different couch?
Yeah, and people always, like, in retrospect, people tell me all the time, like, oh, I wish someone had told me this 20 years ago. And it's like, that's exactly what it is. It's that same couch with the dent of your butt in it because you sit on it the same way, you lean on the same side, and you stretch or contract those tissues for potentially hours a day for 20 straight years. Like, that's a lot of damage over time.
Yeah, so then it goes, okay, so what's the diagnosis? He's, 59 years old. He's got arthritis, he's got bulging discs, he's got muscle spasms, he's got joint pain, and then, or is the diagnosis he's got a bad couch? Right? So you fix the bad coach and you just fixed all those issues.
Yeah, you got the...
Right? I mean, he still needs treatment to keep him running.
Right.
More or less, but far less if we had just got the coach out of the way in the beginning. And that's something I promised myself not to miss in the future.
Yeah. No, but I thought that's a beautiful description of the aggravating factor piece, right? Like you came up with an accurate diagnosis. I'm sure each time you treated your dad, he felt better, but it just doesn't stick. So the accurate diagnosis can only take you far as, for a period, but you have to figure out the aggravating factors, like the couch, and get rid of that so that the treatments can stick for longer.
Yeah, and that's also a hard thing to express to someone, because someone has a couch, they've been using it for years, it looks good in their living room. Now you're telling them away with that coach, right? Like, that's almost stepping out of line, right? But that could be the fix.
Just tell them to give it to their son,
Give it to their son.
Yeah, exactly.
Yeah. Or there's some ways to sit better in the couch, or maybe get a pillow behind your back if there's too much depth in the couch or something like that. But also just get a better couch.
Yeah, like there's a lot of experimenting thing, right? Like I think overall as a team, like we don't want you to be like buying new everything every 5 years to make sure that everything is like pristine quality.
No, definitely.
No, like we're trying to find creative ways that you can, don't sit on this side of the couch, sit on the other side of the couch, or sit in the middle. There's no armrest, but you can sit in the middle of the couch too sometimes.
Yeah, or even try for a couple weeks pulling your desk chair into your living room and sitting on that and watching. See if you get out of back pain by 3-4 weeks.
Right.
Yeah, that's the thing. Like, we knew what the issue was with your dad. Like, if you took scans, if you did orthopedic tests, like whatever it was pretty obvious what physical structure was causing the pain, and we treated that, and yet the pain wasn't going away. So it's like, okay, well, what else is it? And it was the fact that the structures are being aggravated by this damn couch. Like,
yeah, and for multiple hours a day. And it just goes to show how many people have gotten back surgery when they just had a bad coach.
Yeah.
That's a hard, realization.
That's a really good question. It's like,
yeah,
a lot of them, probably most of them.
Like it goes to the analogy that I always share with patients. It's have you heard like the story, like the straw that broke the camel's back?
Yeah.
You put a single straw on a camel, it can handle it. Put 100 pieces of straw on a camel, it can handle it too. Continue that, maybe on the 999th piece of straw, you put it on and the camel's back breaks. Was it that last piece of straw that was causing that really caused it to tumble, or was it the accumulation of all those straws? Mm-hmm. So the question always is, it obviously is the accumulation of all those straws. So it's like, how can we slow down the accumulation of these straws on our patients?
Or take some straws off.
Yeah, or how can we actually physically take these straws off by having them, give their couch away? Yeah. It's like, how can we remove these straws so that their back doesn't break?
Yeah, it's huge.
And you can also, the other kind of element of the trifecta is that you can make the camel stronger. Like, it's good to offload all that extra weight. It's good to address all those straws, but you can also use things like exercise in order to make the camel stronger, right? Make your body more robust and more resilient.
Yeah. Beat me to the segue. Perfect. Third trifecta, exercise plan. So what is the exercise plan? What is that?
So the idea is that, going back to the complaint of our prototypical patient, that they feel good for a few hours after they get treated, but it doesn't last. Okay, well, why doesn't it last? The language that your nervous system and your tissues use is tension, right? That's what your muscles, your tendons, your ligaments. That's what they all respond to. And realistically, when you get into it, almost all the treatments that we do involve applying tension to a tissue. And that's how it heals, right? Nature responds to that. And so the idea with an exercise program, and that includes stretching as well, is that you need to teach the body, teach the muscles, ingrain these motor patterns, and really just make the structures stronger, for lack of a better word, right? More resilient, more resistant to injury.
I like how you reduce it down to tissue tension, because that's what it is really. So if you're strengthening an area, we're trying to increase the tension, or not just the tension, but the capability for tension. I mean, there's a lot that goes behind the word tension, but in a very distilled way, or stretching it, or working the tissue, you're trying to reduce that tension. But a lot of people, and we've talked about this before, is, I got really tight, my pec's really tight, or my traps are really tight.
And I stretch it, and nothing's helping.
Yeah, I stretch all the time, and it's still tight. It's like, well, maybe that's not the problem. Maybe it's because your mid-back is super weak, right?
Yeah.
A weakness can cause that just as much as a tightness.
Absolutely. Like that, it's that asymmetry on either side of a joint. Like if you look at any of your muscles, there's almost like a mirror muscle somewhere else, right? You look at your bicep, flexes your arm up. You look at your tricep, flexes your arm down. So let's say hypothetically that your bicep is super strong, super tight, but your tricep is super, super weak. Okay, well, that's not a very good balance for your elbow or your shoulder. And it doesn't matter how much you stretch that bicep, that tricep's too weak, and it doesn't restore the balance of that joint. And that's really what we're looking for.
Yeah, and to go even further, what is that going to do to your elbow joint as a joint? As a joint that works upon basically a pulley system. So, you have a very weak tricep, a very tight bicep. That joint movement is just going to be grinding. The mechanics are going to be off, right? There's not going to be the right amount of roll and slide in the joint. It's going to get compressed and irritated.
Yeah, it's just like a car with poor wheel alignment, right? If part of that tire is getting more wear and tear than the other three tires, obviously that's going to be your weakest link. And that kind of goes back to what we were talking about earlier with like, how did I get arthritis in my elbow, let's say? Did I wake up with it one morning? No, I've been developing it for 20 years. How has that been happening? Well, it's that tight bicep has been pulling the joint out of place, and one part of that joint and that cartilage has slowly been rubbed away over the years.
Yeah, so like it's like, I guess when we're assessing and we're taking a look at your aggravating factors, some of those things is you got too much tension in these tissues, and you got a weakness in these ones. And that's where the exercise program is really important, because it's not just go out and YouTube like a full body workout and just go to town on that. It's not just it's very specific exercises that we're targeting the areas that you need to bring up to speed. If the left side's weaker than your right side, we got to bring your left side back up to speed. If the front half of your body is stronger than the back half of your body, we got to bring the back half back up to speed.
Yeah.
We don't want to work up the front.
Right.
We want to do the opposite.
And that's the biggest issue with people that work out on their, it's great to exercise on your own, but what a healthcare professional can bring to the table, and what Melissa, our physiotherapist, is the best at, is you can go to the gym and work in a muscle that is just going to make your problem worse, but what are we going to fix specifically? What is the root issue, or what's the low-hanging fruit that will fix it? It's a different purpose to working out,
right? And just because you're doing an exercise doesn't necessarily mean that you're doing it correctly, first of all,
right,
or that the firing pattern of those muscles is correct. Like a perfect example, a test we do, we get people lying face down on the table, and we get them to just raise their leg straight up. And so what we see in a healthy individual is that the bottom of their glute, the bottom of that, like the fold of their butt cheek, basically, that's the first thing that fires. And it makes sense, right? Your glutes are the biggest muscle in your body, and you want to use those big muscles to walk around. What you don't want is your lower back to scrunch up or your hamstrings to scrunch up. So another one that we hear all the time is that people have tight hamstrings. Okay, you have tight hamstrings. You've stretched them every day for 10 years. They're not getting any looser. Why is that? It's because you're not using your glutes to walk. You're using your hamstrings, and they have to have that residual tension. And so part of literally what Melissa is an expert with her red cord therapy is identifying the order that the muscles fire in. It's not just which muscles have the tension in them, it's which order you're using them and which one you're prioritizing.
Right. And also, sometimes you'll have a strong glute, but it's just not firing. Or it's not firing in certain movement patterns that it needs to be.
Yeah.
I mean, it's not, typically they'll be weak if they're not firing, but sometimes it's just, when I do these certain exercises, these certain movements, it's just not engaging, right? So it is really more of the function rather than looking in the mirror or whatnot.
Yeah, it's like it's the patterning, right? It's how your muscles coordinate with one another. No muscle really works in isolation. There's always, it's almost like an orchestra, like a well coordinated orchestra of your muscles firing in a specific pattern to do that movement. And again, Melissa with her red cord system is phenomenal at identifying those deficiencies in that flow.
You guys are coming up with some killer metaphors today.
Yeah, that was a good one.
Just an orchestra of, it's like music to my ears.
Music to my ears.
Muscle firing patterns. Wow. I think on that note, that covers the three.
Yeah.
The three trifectas. So 1, expert healthcare. 2, the aggravating factors. And 3, the exercise program. If you have all three of these down pat, you will get better. You're gonna get better.
You will.
It's the one of these three things is lacking. I think that perspective and like patient basically perspective of their treatment and their mood is something that kind of fits into aggravating factors or exercise plan that can kind of play a role into that.
Yeah.
But ultimately, if all these three things are straight, you will see the improvement that you're looking for.
Completely agree. And I think that's kind of what a lot of patients don't understand, and I think that's kind of a weakness of kind of the traditional healthcare model, is that everybody focuses on the expert healthcare. But the patient comes in, and because they are depending on that, they're more or less like, okay, I'm here for you to fix me. It's like, no. We're here to work together so the two of us can fix what's wrong with you. Yeah. And as we've pointed out, 2/3 of that trifecta is stuff that you do outside the clinic. Stuff that you do every day. That's the stuff that the patient has to do. I can't do the exercises for you. I can help loosen the tissues. I can do my part. But you need to make sure that whatever it is that's causing that issue, you deal with on your own, kind of thing.
Yeah. So if a practitioner doesn't emphasize that bit, is it still expert healthcare?
I mean, in a way, your results won't last.
Yeah.
You'll probably get enough. You'll probably get enough for some relief, but I'll guarantee you your problem will probably come back.
Well put.
You're not changing anything.
Well, this is super informative. Thanks again for listening to all our listeners.